Glaucoma is a slow buildup of pressure inside of the eye. And what that leads to is the only outlet for the pressure is the soft optic nerve in the back of the eye. So the hard eye starts to pinch that optic nerve, which happens to supply you with all of your vision. So as it pinches that optic nerve, it slowly erodes your peripheral vision, your side vision. No, not usually. It's known as the silent thief of sight because it's a very gradual disease, and the visual field loss, the peripheral visual field loss, is very, very gradual over time. So you will just lose a little bit of your field each year and you don't even notice it. Early detection is key. Once that nerve has been destroyed, you can't get it back. So once you have nerve loss, it's there for good. So yeah, you want to detect it early and start to treat it early. Detection of glaucoma has really come a long way. First of all, obviously you check people's pressure in their eye. High pressure can be a warning sign. There's also low pressure glaucoma. And so you have to be a little more astute in detecting that. You want to do regular peripheral vision checks, peripheral visual fields, and you want to take a good look at that optic nerve, because as that eye gets hard and pinches that optic nerve, the optic nerve will start to show some changes and some damage. There's also a new machine called an optical coherence tomographer, which can look at that optic nerve and really detect nerve loss much earlier than it's ever been able to in the past. Once you detect glaucoma, usually treated, at least the initial line of treatment is eye drops to help lower that pressure, or sometimes help the eye drain the fluid that's in the eye a little bit better. Secondary treatments are different types of laser surgeries. Glaucoma is not really preventable. I mean, I think the only way to prevent it is to catch it early and get people on treatment, whether that be eye drops or surgery. It's also, there is no cure for glaucoma either. So I think the only way to prevent it is just to detect it early and keep the vision that a glaucoma patient has. There are different warning signs that go up with glaucoma, different red flags or risk factors. Sex, patient sex, females are a little more likely. Patient's race can have a factor. Family history is a very strong one, especially maternal family history. Your mother, your grandmother makes you a little more likely to develop glaucoma yourself. So those are just a few of the risk factors. High blood pressure, another risk factor.